if I'm still lagging.
Good afternoon. This is Greg Ehlers from REQ Consulting with the REQ Consulting podcast. And today I have the honor of having my guest be Jawad Arshad, the CEO of WoW Health. Hi, Jawad. How are you today?
I'm doing great, Greg. How are you?
I'm doing great, thanks. So, Jawad, you founded and had the vision of WoW Health a few years back. In today's day, we've got a lot of challenges, higher costs, shortage of services, disappointment with services. Maybe you can give us a little bit of a background on the origins of WoW Health, why you founded it, and your vision for WoW Health into the future.
Thank you so much, Greg. Yeah, I'm a physician by training, right? So when I think about healthcare, how people get their healthcare benefits in the community, I think I have a little bit of a different perspective because of my training as a physician, right? I have worked on with large health systems in the past, but then I've also been an employer, buying healthcare benefits for our medical group, and of course, as a consumer, always using these benefits whenever needed. Um, and we know that there is a big gap in what people think they are getting when they get their healthcare benefits and what they end up getting uh, when they actually go to use them, right? Because let's face it, at the end of the day, 95% of the events in healthcare do take place in the outpatient setting, right? They take place outside the four walls of a hospital. And if we can recognize that, especially when we're looking at age under 65, right, what we realize is that everyone, regardless if you have an insurance plan or you don't, is a self-pay, right? You're paying for that care out of pocket because, of course, you have co-pays, deductibles, co-insurances, right? Your insurance part, so to speak, doesn't actually come into play unless you end up in the hospital, unless you end up needing surgery, unless you end up in the ER, God forbid, right? So our goal at WoW Health was we wanted to bring really meaningful access for not the 5 to 7% large medical events where you, God forbid, may end up in the hospital or the ER, right? Our goal was to address that 93 to 95% of the events where you need to go see a doctor, where you maybe need to go visit an urgent care, where you need to take your blood pressure or diabetic medication. Maybe you need to have some labs done. You need to go see a dentist, right? Our goal was to be able to provide some meaningful access, and we have been really successful in building a nationwide sort of network of providers that are going to give that to our members without you having to buy an insurance plan. So the WoW Health is a membership-based model, right? You pay a monthly membership, and just like any membership, you will get some benefits at zero cost and then some benefits at a discounted rate, right? And we can kind of talk through what those benefits are.
Absolutely. So, and we've had this conversation previously, so it's not like I'm introducing it now, but when you describe healthcare in aggregate, Jawad, it's a lot like a computer in a sense. You only use 3 to 5% of what it offers on a regular basis, but you're paying for that 95 to 97% that you may or may not ever utilize at any point in time with a comprehensive plan. So when we talk about the membership health membership program of WoW, give us a little bit of an idea both of the cost and what that cost entitles a person to if they're a member of WoW Health, and how hard it is or how easy it is. That's a softball question, Jawad, to actually sign up for WoW Health.
Absolutely. Yeah. So I think that, when we think about healthcare, right, we break it out into really sort of four big buckets, right? You say, look, you are you're going to be in need of seeing a doctor, okay? That may be done in person. It may be done effectively via telehealth, via a video or an audio call with the doctor, right? So that's one piece. I need to see a doctor, and we're going to try to make that really easy, right? Second, in today's world are the stressors, right? Everyone is having to deal with financial, family, relationship issues, and so on, is mental health support, right? So we are going to be able to bring some really meaningful resources that are going to address that, right? Then the third big piece is always going to be medications, right? A lot of people are sometimes taking medications for high blood pressure, for diabetes, for high cholesterol, for thyroid disease, whatever it may be, right? So we're going to need to address that as well, where we bring some meaningful access to medications. And then the fourth piece in the outpatient setting, really, that we want to address are diagnostics. I need to have some labs done. I need to have an x ray, a mammogram, or an MRI, right? Maybe I need to have a procedure, right? I was told I need to get a stress test on my heart, you know. So we're going to need to address that as well. Okay. So what we have done is for $2 a day, right? So sort of half a cup of coffee a day, right? So for 60 bucks a month, we're going to give our members access to a few things, right? And I'm going to actually share my screen, Greg, and kind of walk you through what those benefits look like. Okay.
That's great.
And so what I will do is, as I kind of switch over and share my screen with you, I'm going to at the same time address that last question, the softball question of how easy it is, right? So if when our members come in to WoW Health, and we will give everyone a link at the end of this to be able to join WoW Health. But when I come in, I can download the app, which gives you the same experience, or I'm just going to log in with my personal account, right? So when a member logs in, they are going to be brought to what's called their dashboard. So this is my account. We are going to address the same things that we talked about, the four more main buckets, right? I want to see a doctor. Maybe I need to take some medication. I really would like to get some help with stressors and counseling, perhaps. I want access to diagnostics and procedures, right? So if I need to see a doctor, there are really a couple of ways that I can do that, right? Sometimes I need to go see a doctor in person, and other times I can get some problem taken care of quite effectively via telehealth. Sometimes we're not sure what's the right thing to do. So what we have done is brought our member or patient advocacy line, our PAL, right? You can talk to them, and they are trained medics. So they are going to be able to address and be able to answer questions and help guide you what the best approach would be, right? So that could be a really great way to get some real-time help in deciding. But let's say if I did think about doing telehealth, right? Our virtual care platform is actually incredibly comprehensive, right? We have a few things that I just want to point out. You have 24/7 access, right, to a doctor via either video or audio for any urgent care type conditions, you know, urinary tract infections, sinus infections, right, fevers, that kind of stuff. At the very least, you can talk to a doctor and figure out if you need to go to the hospital, or can this wait till tomorrow when you can go in to see someone in person. The other really important piece is to be able to have some continuity of care with a primary care physician, right? So I have someone as a sort of as a Sherpa who can help usher me through my medical journey, right? I can talk to the same doctor every time, right? It is free, it is by appointment, but you can do audio or video calls, right? And every time you kind of meet with that same provider, and it really kind of brings that, closes that healthcare gap. We give access to absolutely free 24/7 counseling services, right? And these counseling services actually are fairly inclusive, right? You have some student life issues, family life, health, work life, you know, a lot of things that we are dealing with on a day-to-day basis. So we can connect you with a counselor either for audio, and actually it says audio here only, but for follow-up appointments, you can do a video call as well,
Got it.
right?
That's great.
We do have some fee-for-service services like dermatology or for psychiatric care, but one of the really exciting ones is being able to, sometimes I don't need to talk to someone. I just really have a question. Maybe I'm starting a new diet. Maybe I've heard something about an alternative medicine solution. I want to talk to some specialist in that, right? Sometimes women health issues or pediatric issues. We have a new baby and it's always crying at night, right? So sometimes I don't need to see someone. I just have a question that I would like addressed. And this basically gives us an opportunity to be able to send a message. You can pick a file and be able to get that answer within 24 hours.
That's great.
So those are some of the things that, really give our members access via telehealth. But then we have access to over 30,000 medical practices nationwide, right? That is going to, you will be able to go see a primary care physician for only $10 a visit, right? Your membership,
That's extremely important right there, Jawad, because
exactly.
what people fail or forget is when you have a high deductible plan that you may have that you get from your employer, but you go to the doctor and they say, it's $350, you haven't met your deductible. So that is that can really be a shock to a lot of people that aren't aware of that situation. So
Yes.
that's a big deal.
So I think I want to, let's reiterate that, right? Because I think that's super important for people to recognize that we are going to reduce that. So for $60 a month, right, we're getting our virtual urgent care crisis telecounseling, virtual primary care. But then if you do need to go see someone in person, it's going to be $10 a visit, or in-person urgent care is only going to be $25 a visit, right? That's a really affordable price point, in addition to, of course, having that patient advocacy line to help assist you. But we do one better, right? We are going to give you one free visit per year for an in-person visit for a physical, which includes your screening labs,
That's
right?
great.
So now you can sort of get a routine, a maintenance checkup once a year at zero cost out of pocket, right? You can go see that primary care or need to go to an urgent care, and you just pay a nominal fee of $10 or $25 for in-person, or virtual is free anyways, right? So really, as I say, half a cup of coffee a day, right? It's $2 a day, and we don't need to have an insurance plan to be able to use these. These are packages, because they are membership models, can be used even as a supplement, even if you have an insurance plan. The other
And
great thing, go ahead, Greg.
just on that, just to one follow-up question, because some people will be asking the question, well, what if I'm getting a subsidy from a state or from the federal government? Does this offset that?
Absolutely not. Again, this is not a traditional insurance plan. We call it a membership model. As I said, with a membership, you get some services for free and some services at a significantly discounted rate, but these are not qualified health plans. And so, therefore, there is no concern that you are going to lose any subsidy that you may have qualified for.
That's fantastic. That's fantastic. So as I bring all this together and listen to what you have had as a vision from 2018 to now, talk to us a little bit about some of the feedback and the growth that you're seeing due to the high costs, whether it be inflation or the amount of people being forced to work two jobs, et cetera. Talk to me a little bit about what you are, what kind of feedback you're getting. I mean, how excited are people about this? I know I am, but I'm also, you know, a bit biased because I have a distaste for the larger BUCA plans that really are much more difficult sometimes to navigate. And I've spent a lot of time trying to help people in that endeavor. So I'm excited about what you've done. So I'd like to, in closing, just give us a little more feedback and any other message you'd like to share.
Yeah, thanks, Greg. I think we're seeing really sort of hockey stick type of exponential growth, right, in our membership. We have some great partners that are introducing and socializing this concept. I think that people are also realizing after years of having to pay significant out-of-pocket costs, and then more importantly, never quite being sure what anything costs, right? Here is some transparency, right? When you go get your medication, when you get your lab, if you go see a doctor, you know ahead of time what anything is going to cost. And I think that's really, really important, right? That we need to make sure that everyone has that control and transparency. So we're super excited at being able to sort of provide a different product, a different solution to healthcare access than just insurance, right? Because let's face it, health insurance is broken, and it's broken for many reasons, right? Which is a different conversation
We could be
altogether.
here a week on that one, Jawad.
Yes, exactly. So here is our solution in making sure that we can bring meaningful access so that people can stay well, they have resources that help them stay well, and then God forbid, if you do need assistance to take care of your medical issues, right, then we are going to be able to help you there as well. Now, we of course are not saying that we are a comprehensive insurance plan. So God forbid if you end up in the hospital or the emergency room, right? No one is going to be able to provide you that type of coverage for $2 a day. But I think that our goal, again, is not to address the 5% of the what ifs of life. Let's focus on the 95% of what I really do need on an ongoing daily basis in a meaningful way, right? Regardless if you have an insurance plan or you don't.
That's fantastic. Listen, it's been wonderful visiting with you today. I really look forward to our next visit, and have yourself a wonderful day, Jawad. Thank you very much.
Thank you so much, Greg. I appreciate the opportunity.